Dallas Obrick is one of thousands of people in Saskatchewan waiting for surgery. She's needed a hip replacement for nearly 3 years.
I've been gradually getting worse to the point that to come here today, I needed a wheelchair.
Obrick was a guest of the opposition at the legislature today. After speaking to reporters, she met with Premier Scott Moe for about 3 minutes.
I just wanted to assure Dallas that this is getting our surgical capacity up and running so that not only is it sustainable into the future, but is able to address the backlog that we've acquired over the course of the past 20 months is of the highest priority of this government.
Obrick says the government should have acted sooner in preventing the redeployment of staff in September. The surgical wait list in Saskatchewan is now at 35,000. Opposition leader Ryan Miley says the government should impose gathering restrictions to get the COVID case numbers under control. He says that would prevent further surgical and health service delays. But Premier Moe says the government is not planning on implementing any further measures.
Everything that we do across our healthcare system and with respect to measures is contingent on the on where our not only our COVID infection rate is, but where our hospitalizations ultimately are today and into the future. And thankfully, that is dropping. We're down about 64% in our active cases.
On Wednesday, the government announced plans to start moving redeployed workers back to their old jobs. By month's end, they plan to have 90% of staff back in their old jobs if they're not needed in the COVID effort. Obrick believes she'll be waiting for a hip replacement for quite a while longer.
I will be like everybody else and wait my turn and do what I can to get through each day.
Despite her health condition deteriorating, Obrick is able to keep her sense of humor.
Am I worried about dying? Well, I sure don't want to. I've got an awful lot of knitting to do.
Adam Hunter, CBC News, Regina.